Hi, everyone. My name is Liv, and I'm a speech language pathologist at the Down Syndrome Resource Foundation. Today, I'm excited to be sharing our service delivery model changes with you that will be coming underway this summer, 2021. The purpose of this webinar is to communicate these changes to our existing families and hopefully answer any questions you may have. So I mentioned I'm an SLP at DSRF, but I'm also a member of the Service Delivery Model Committee that was formed to implement our new service delivery model. This committee has representation from all disciplines at DSRF and is comprised of people who have been at DSRF for over a decade to others who are a bit newer like myself, who have worked in other service delivery models. Today, I have the pleasure of talking more about our new model of service that we're really excited to share with our existing and new families moving forward. So listen up. If you are a returning DSRF family, there's going to be some changes around here. They might feel big, maybe even huge. You might not remember everything I covered today. You might even have some questions along the way. And we encourage you to ask them. We're here to help. Even though change can be hard, everything is going to be okay. Because you know what they say, sometimes change can be good. And no matter how you're feeling about these new changes, we have each other. And just remember, we can do it. So today, I'd like to start by thanking you for taking the time to view this webinar. And as I cover our service delivery model changes, I'm going to be talking about our current service delivery model and the barriers that we were experiencing, both us and some of our families. I also would like to cover our new service delivery model, which is the solution and benefits to these changes. And then I'm going to end today with some frequently asked questions and also a case example to hopefully make things a bit more clear. So let's talk about our current service delivery model. Right now at DSRF, as you know, parents are given 48 hours to register for programming, which is based on our DSRF calendar. There is a possible 4 blocks of therapy a family can sign up for a year, which varies, from 8 to 12 weeks. And this is primarily how we deliver our one-to-one therapy. Now, in 2019, DSRF underwent a service delivery model review. This was conducted by UBC Sauder School of Business students. The goal of this was to provide DSRF with recommendations on how to grow its service delivery model into one that is responsive to the current and future needs of its families, partner organizations, and staff. The methods included interviewing similar organizations to DSRF, family interviews, families that did and did not access our services, and staff. The main recommendations from this was to revise DSRF's online platform, which I'm excited to say is underway and will be launching next year. Foster community engagement through a provincial resource provider, and look into the feasibility of long-term changes in the way DSRF delivers its services, such as the block scheduling and in-home services. The service delivery barriers that were identified there was a disconnect between evidence-based practice and our current model. There was this inflexibility in service delivery frequency and intensity that we could provide. From research, we know that different treatment approaches work for certain students. They might need different, frequencies or intensities. And currently, we were limited to the therapy approaches that we could provide due to the lack of flexibility in scheduling, which also was excluding some families who couldn't commit to the full block of therapy. There was also a lack of continuity in client care. Sometimes families had to change therapists, and there were some benefits of staying with the same therapist for longer, which could help build rapport or strong bonds. We were also seeing sometimes minimal carryover effects due to lack of practice in real client settings. We know that the best outcomes operate within a client setting like home or school in order to maximize impact. However, our capacity to do this is currently limited to just within the clinic. There was also a need for increased collaboration between therapists and teachers within DSRF, We didn't take advantage of having a number of therapists or teachers with various specialties within the same building, resulting in missed opportunities for learning for students and staff. There was also an inaccessibility of services due to geography and time constraints. So families were reporting a lack of flexibility of timing or scheduling or even location of DSRF programs. Right now, most of our programs are within the Burnaby hub. There was also strict registration deadlines. So families reporting that they would miss this 48 hours to register, which would usually result in them maybe missing a block of therapy or having to wait to the next block of therapy, if they're away or miss the email or the reminder. So this was another barrier that families identified, which leads us to think about change in these times. Especially with COVID, it presented an opportunity for us to reflect on our current model and leave room for improvement. That one size in terms of service delivery doesn't fit all the diversity of our family needs. So this was our solution, our new service delivery model. So let me take some time right now to walk you through it. So families who want our services log on to our website and request services by filling out our service request form. Then they're invited to participate in an intake meeting with DSRF staff to understand family needs, goals, and priorities. If you're a returning family, this might look a little different, like meeting with your current therapist or teachers. Needs of the family are discussed and goals, and then the family is put on the wait list and waiting for a spot for service. They're picked up for service, and service length and time, again, is goal driven. So it depends on family needs, availability, what their goal is, and what we think how long it'll take. And then during this, we're going to implement practice periods. This is built-in time to take a break from direct one-on-one in-clinic services and have time to generalize these skills outside of therapy, at home or at school. Then your therapist or teacher will check in during the practice period to see how things are going. You could be picked up again for service and come back in the clinic. Or, if things are going well and you've reached your goals, you could be discharged or maybe put back on the wait list, for another service, or if lots of time has passed, or maybe you need more time to practice your goals. So that's why there's lots of arrows here to kind of capture the unique needs of our families and the built-in flexibility that we now have within this model to do so. The benefits of doing this model is that it's goal-driven rather than block-driven. The goals determine the time that you're going to have with your therapist or your teacher. This increased flexibility in service delivery type and duration. If your family needs consultation, we can provide that. If you need one-to-one therapy, that might look like bi-weekly or weekly. It could be direct service, working with your therapist or teacher. It could be us coaching. It could be a hybrid model of both. Maybe we have lots of students with similar goals, so we form groups to work on them. There's lots of increased flexibility with service when the goals drive the time, rather than working within the block system. Families need to only register once. So once you request a program, you will be notified when service can begin. We're also going to be implementing an objective way to prioritize clients, which will ensure that we're seeing people who are in more immediate need sooner. This also ensures a holistic approach to seeing family and student needs and priorities, because we're putting them at the center of service and planning those long-term goals, how long it will take, the frequency, the duration. We're doing all that planning together. It also will lead to an increased opportunity for transdisciplinary collaboration and streamline gathering information from families, which will lead to better serving our communities. Because when we're letting the family goals drive our service delivery, This ultimately puts you at the center and makes our services family-centered. When we base our services on what families need, we want to work in partnership with families to better understand their unique circumstances and help them decide what will best suit their families. It recognizes that all families are different and unique, and what works for one might not work for another. This approach is recognized as an effective way to improve outcomes for families. I really like the analogy of a shoe. One size does not fit all. And when you go to a store to buy a shoe, they don't just hand you a shoe. They ask you questions like, what size are you? What will you be needing the shoe for? Are you hiking? Are you going to a formal event? What level of support do you require? And then they fit you with the shoe that's best. And we're trying to do the same. We want to know your needs as a family and then plan therapy around that accordingly. So to make things a bit more clear, let's go through a case example together, walking through this new service delivery model. Little Brooklyn Heights needs some support. Her parents log on to the DSRF website and request services by filling out the service request form. This form asks them questions about their priorities and their main concerns. This is what it looks like on our website. You go to request services. On the website, you can request individual one-to-one services, which are all listed there. There's also a button for group programs that we're putting on, as well as other services, things like maybe a special presentation on Down syndrome or one-off consultations. Now, because Brooklyn's family is new to DSRF, soon after they submit their request, they receive a welcome call from our intake officer, Asia. This is a new role within DSRF. She welcomes them to DSRF, briefly reviews their request with them, and they're sent a welcome package with more information about Down syndrome and services they could access. They're asked about their availability for the upcoming intake meeting. Parents receive an email from DSRF staff with their intake meeting date and time. If you're a returning family with us, you will be getting this email about your intake meeting. And in preparation of this meeting, sent a comprehensive case history form. We want all families to complete this because we want to update all our files and make sure everything is up to date. It covers things like recent medical history, communication, feeding, motor development, and educational needs. At the intake meeting, Brooklyn's parents meet with DSRF staff. This is an opportunity to discuss their needs, their goals, and priorities as a family. Shortly after their intake meeting, Brooklyn is put on the waitlist for programs that are appropriate. In the meantime, DSRF staff have suggested getting her hearing retested before service begins, so parents book an audiologist appointment. So while she's waiting, maybe she requested speech, and we know that speech really relies on hearing. So we suggest, it's been a while since she's had a hearing test, so let's get that checked out. Or maybe it's a sleep study, because we know that that will impact learning. So as she's waiting, making sure all the health is taken care of. Then Brooklyn's parents are contacted and told when service can begin. Brooklyn and her parents create specific goals together. Brooklyn attends weekly therapy sessions at DSRF. The number of weeks of therapy is determined by Brooklyn's family's goals. So for example, let's say their goal is, we'll say 10 words by November 2021. DSRF staff and parents review goal progress 6 months later in their goal plan. To help Brooklyn meet these goals outside of clinic, the practice period begins. Parents continue the practice at home during this time and are given any resources or materials that may be helpful. Of course, consultation is always provided and available to the family during this period. DSRF staff check in to see how progress is going at home. And then next steps are discussed, whether that be coming back in for direct service, continuing to practice at home, or possibly discharge if we've met our goal. So let's review some frequently asked questions you might be having at this time. When will these changes come into place? This summer, 2021. When can I register? So registration is now open and will remain open. You can register at any time by going through our website at dsrf.org/register. You might get an email from JNAP, and I briefly want to touch on this. JNAP is how we do our charting system at DSRF and keep all of our student records online. Through JNAP, you'll be able to create a profile, view your upcoming appointments, share information, things like reports, and also we're thinking about doing billing through this method as well. So if you haven't already, log on to JNAP and create a profile. What is the intake meeting? So it's a one-time transdisciplinary intake meeting to gather information for new clients. We estimate this will probably be about a 1.5-hour meeting. It's an opportunity for us to share information and check in regarding goals, assess priorities, and progress. Do I still need to do it if I'm a returning client or registered in only one program? All returning clients will be asked to participate in a shorter version of the intake meeting. This intake process is for one-to-one therapy requests, so exceptions to those who just attend our group programs. From that meeting, service providers will better understand family needs and give their recommendations. So right now, if you're a current or existing DSRF family, this might look like you meeting with your current or present therapist or teacher and reviewing your goals and progress at this time. Who attends the intake meeting? It's attended by students' main supporters and 1 to 2 DSRF staff members, depending on the needs and registration request. So depending on what your main concern is or what you request. Younger clients don't need to attend this meeting. We're mostly gathering information, but teen and adult clients are asked to participate if it's appropriate. How is the cost of the intake meeting determined? We take the number of therapists and teachers attending and times it by the time. Intake meetings are usually a bit longer and require more staff time, but there's some benefits to multidisciplinary approach. For example, you only have to gather information once. Everyone saves time in the long run. You're not having to repeat yourself to different therapists or teachers. And usually the first 2 to 3 sessions of a block are kind of used to gather information from families anyway. So this allows us to streamline services and better prepare for our sessions moving forward together. How will you manage your waitlist? So we anticipate waitlist will be actually very manageable to start, considering we manage a very small waitlist currently of students who request a spot and don't get in. We're going to be using an objective measure to determine client priority based on other similar service provider matrices, taking into account considerations that determine the urgency and impact on client daily functioning. We're going to increase in group programming and opportunities for practice periods that will allow us to see more people. And also, it's an opportunity to hire more staff on demand if we need. Now, what if I can't make the therapy time that's offered to me? That's okay. We might offer you a spot that is available that might not work for your schedule. We will continue to offer spots to those at the top of our wait list. And the more flexible you are, I will say the probably faster we could probably see you, but you won't go to the bottom of the wait list or anything. And actually, we're going to be giving increased priority the longer you have to wait. What is this practice period? So it's an opportunity to practice after therapy to increase the likelihood of generalization of skills and strategies outside of the clinic, which is ultimately the goal. The student will go on monitor during this time, and the practice period length varies from student to student, determined at goal review when discussed with the family. The therapy and teacher will then check in with the family regarding the progress, and they could be picked up for service again, say if a new goal arises or they need more support on the goal that they're working on, or they could be put back on the wait list, or if things are going great, discharged. So At that time, we will check in with family and assess what's our next decision moving forward in terms of what you need. A question we also got was, if I'm driving to DSRF for in-person services, can I request back-to-back sessions? You certainly can request this. We can ensure that we can accommodate your request, as each discipline will be managing their own waitlist, but we can ensure that we will communicate amongst our team to determine if that is preferable and if we're able to pick up at the same time. If that's the case, wait times for service might be a bit longer. In some cases, it also might not be preferable to access programs at the same time. For example, some of our students with back-to-back sessions get very easily fatigued. So it actually might not be that beneficial to do back-to-back sessions. Will the 2 program request maximum still apply? So the 2 program maximum was enforced during COVID as our response to a high demand of requests while we were learning our new platform and service, which was teletherapy. It will no longer apply. However, when requesting more than 1 program, we ask that you prioritize your service requests so that we can have a better understanding of your family needs. So by all means, request what you need as a family. There's no maximum on what you can request, but we do just ask that you do let us know what are your priorities or your top 3. What is our cancellation policy? Non-emergency cancellations require 24 hours notice. These include vacations, pre-planned medical appointments, family events, school events, parties, sports events, and lack of childcare. If there are more than 3 non-emergency cancellations within 3 months' time, the client might lose their weekly spot in the therapist or teacher schedule. Sessions that are not canceled within 24 hours notice will be billed at the full rate. We understand that accidents and emergencies happen that might prevent 24 hours notice from canceling or rescheduling your appointment. So we are going to continue with 1 missed session per service period that will be covered by DSRF to support families. And when I say service period, we are saying that is within 3 months. If a session is canceled by the DSRF due to the therapist absence, weather, or other reasons, families will not be billed for the session. If staff need to cancel a session, we will try to give as much notice as possible. Now let's talk about illness in the year of COVID. So in the event of illness, please contact DSRF in advance if possible. DSRF recognizes that illnesses can come on suddenly, and our priority is the health and safety of our families and our team. And we ask that families and staff do not attend if persons in the sessions feel ill. Please cancel in-person sessions if your child has a fever, diarrhea or vomiting, uncontrollable cough, anything contagious such as pink eye or rashes, sore throat or swollen glands, other sign of illnesses, or lice. Clients must be fever-free for at least 24 hours prior to a scheduled session. For mild symptoms or in certain circumstances, a virtual session might be an option. So after consulting with your therapist or teacher and an alternative virtual session is not possible or advisable, DSRF will not charge for the canceled session. What is your late policy? Please note that if you're over 15 minutes late for an appointment and we do not hear from you, it will be considered a no-show and families will be charged the normal session fee. If you are late, your session will be shorter as the teacher or therapist cannot go beyond their regular scheduled end time. Teachers and therapists have full schedules, often back-to-back sessions, and repeated instances of lateness or unexplained absence may impact your priority for services in the future. If a parent or guardian leaves the center or outdoor area while the child is in session with our team, the parent or guardian must have a cell phone with them that is charged and in working condition and must stay within 5 minutes driving or walking distance of the session in case of emergency. Can we end services before our goal is achieved or practice period begins? We understand that circumstances come up that might warrant a change in our original therapy plan. We ask that families give us 4 weeks notice if wanting to end services or increase or decrease the frequency of our services. Wait times may vary if wanting to increase frequency. Can I put in another request? And if so, how? So say if you are, seeing maybe speech, but concerns with behavior or OT come up, definitely you can. You can do so through our website or your current therapist or teacher. They can talk to you about your needs. Can I request to see a specific teacher or therapist? You can request a specific therapy or teacher, or I should say therapist or teacher, although we can't guarantee that we can accommodate. If there is a specialty service that one of our therapists or teachers has training in, we will absolutely do our best to make that accommodation. But with that said, DSRF therapists and teachers are all specially trained to provide high quality services specific to Down syndrome. If our session is canceled, can we schedule makeups? So now that we're on a rolling system, when a cancellation occurs, your therapist will just see you the next appointment time. You can talk to your therapist or teacher directly about the possibility of scheduling a makeup session, but it's not guaranteed that a makeup session can be scheduled within the same week, as it depends on individual's therapist schedule. Makeup sessions are not guaranteed when there's a violation of the cancellation policy. For example, if you are charged for a no-show, we might not be able to reschedule that visit. Can I still apply for a DSRF bursary? We will continue to offer bursaries to families with our new service delivery model, and you can apply here. If I have more questions, who do I contact? So in the past, Nimet was in charge of our registration and organization of schedules. But since COVID, Nimet has moved to our accounting assistant and facilities coordinator position. She no longer is involved in registration or programs. If you have further questions, please email programs@dsrf.org. This past year has been a time of reflection on how we currently service our families and the potential for improvement. We are excited about these new changes and are confident that this will allow us to better service our current and future families. We sincerely appreciate your patience, understanding during this time as we implement our new service delivery model. Thank you so much for your attention today and taking the time to hear about our new model of service. Thank you.